That begins from the time that the child enters the clinic. Many pediatric offices have themes that are intended to put a child at ease. So there are lots of familiar items around, whether it be visual stimulus, movies, pictures, toys, or also olfactory type things like smells. We try to make sure that the office smells good and that things that they're hearing are things that aren't going to cause anxiety. So that's where it starts. Then we go to a list of very common behavior management techniques. The first thing we do is we get to know the child well on their own level. So we introduce ourselves. It's very common to make physical contact, give them a high five, touch them on the shoulder in appropriate ways that they don't feel overwhelmed that you're up in their face or anything like that, but so they feel that you're a friend. And then it goes on from there to things like tell, show, do. When we do things with children, what we want to do is make sure that we're not just going for it and doing it and saying, oh, you're okay. Instead, before we do anything, we tell them about it in child-friendly terms. So we don't use words that can elicit visualizations or imaginations that might induce anxiety. So we use a lot of euphemisms, and it's not because we're trying to in any way make the child to be dishonest with the child. It's because we're trying to educate them in an appropriate on their level in an appropriate way, so that we reduce anxiety. So then from tell, show, do, we'll tell them, and then we'll show them how it's done, and then we'll go ahead and do it. From there on, there are other ways, like distraction is a big one. We will use things like video playback in the ceiling, so show them movies, and then by distracting them with asking them about themselves, asking them about stories, so that they're not focused too much on what's actually going on. Or we change the name and make it a fun thing, so it's distracting because it's fun. That's the biggest one, so distraction, tell, show, do. Beyond that, we run into things like pharmacological behavior management techniques, which include nitrous oxide. Nitrous oxide is a very effective and very safe way to lower a child's anxiety without getting them systemically full of a medication that you have to wait for them to metabolize and wait hours for that to come off. It's quick on. About a minute after they put it on, they start to feel relaxed. They start to lose. It acts as an analgesic, so it gets rid of some of the pain, and it gets rid of the gag reflex. So three of the most common things that people worry about kind of melt away once you use nitrous oxide. And then we have things like sedation and general anesthesia for children who have had bad experiences or whose anxiety level is just too high, and the behavior management techniques, simple ones, or nitrous oxide are enough. Then we want to make sure that they are comfortable, and so we give them medications that help them.